Namaste and welcome to our channel. Today we will explore a truly nourishing and profound topic in Ayurvedic physiology, the physiological aspect of Stanya or breast milk. In Ayurveda, Stanya is not just a source of nutrition for the newborn. It is a sacred secretion arising from the essence of Rasda, embodying the purest form of maternal nourishment. It represents both physical sustenance and emotional bonding, making it an essential part of postnatal care and infant development. So, in this video, we will delve into how Stanya is formed in the mother's body, the role of Ras and Vanvayu in its secretion and flow, the qualities and types of healthy Stanya, and as well as how Ayurveda assesses disorders and imbalance related to lactation. So, stay with us as we unfold this beautiful science where the mother's body becomes nature's first pharmacy and Stanya becomes the first medicine and food of life. So let's get started. So first of all, we discuss about the etymological derivation of Stanya term. The, the entity which is derived from stun or breast and which is beneficial for stun is considered as a stanya. Now how the stanya formation take place in woman's body. So ras stanya is considered as a updhatu of ras or byproduct of ras dhatu. So whatever the food that mother ingests, so with the help of the Jataragni, it converted into the Sar and Kit. So with the help of the Vanvayu, this Ahar rasis gets circulated throughout the body. So during the course of its circulation, whatever the nutritional essential portion is there, having a Madhur taste, which whenever it is enter into the breast or ston, it acquire as a form of the stanya. Now, initiation of the stanya secretion. When the stanya secretion take place in human body. So, due to perturbation, vessels of heart are full, and on third or fourth day, females get breast milk. Now, factor influencing the stanya secretion. So, basically, stanya is pervaded throughout the body as shukra. So, it become visible only when it get appropriate stimulation. For example, sight, remembrance, hearing to voice and touch and love of child make the flow of stanya. A calm and pleasant mind is cause for the happiness to flow of stanya. The physiology of breast milk is a complex, beautifully coordinated process involving hormonal regulation, mammary gland function, and maternal infant interaction. In modern science, breast milk production and ejection occur through a well orchestrated mechanism mainly involving prolactin and oxytocin. Suckling stimulates tactile receptor on the nipple. So this neuronal transmission signal that stimulate the hypothalamus and hypothalamus in turn stimulate the anterior pituitary gland and which release the prolactin and prolactin is concerned with the milk synthesis and further hypothalamus stimulate the posterior pituitary gland and which release the oxytocin and which concern with the milk ejection. Now assessment of the pure stanya. Breast milk which mixes well with water immediately and which is whitish in color, sweet in taste, not other than its normal natural color, pleasant to look at is considered as a pure stanya. Now, what are the factors which vitiate the stanya? So, whenever the mother follow regularly unwholesome diet and regimen, it causes the vitiation of the dosa or concern dosa, and that concern dosa vitiate the ras dhatu, and which eventually lead to the vitiation of the Stanya. Now, manifestation and characteristics of Stanya vitiation. So, whenever the Stanya is vitiated with the vat affects the milk, it floats on the water, it is astringent in taste and it is foamy, looks dry. It affects the body by inducing constipation, less production of the urine. So when vitiated pitta affects milk, it creates the yellow streaks in water. It warm, sour, spicy and burning in nature. So when vitiated cough affects the milk, it sinks in water. It tastes salty, dense and slimy. So, there are the organoleptic examination is there. So that is used to assess the either that breast milk is pure or impure. So the color of the breast or pure breast milk is the white is sponge like appearance. So whenever it is visited with the vat, it appears as a blackish blue, and with the pitta vitiation, its color is appear as a blue, yellowish, or copper color. And whenever it is vitiated with cup, it appears excessively white in whitish. So in concern to the smell, the purest breast milk is having a appropriate smell, and in the vat there is no smell. But in relation to the pith vitiation, the smell may be the fall or odor of the blood. And in concern to the cough, the milk is unctuous substance like ghee and oil. So in concern to the taste, so the pure stan is sweet in taste, and while the vat vitiated stan is astringent in taste, while the pith vitiated stan is having a bitter, sour, pungent taste. And in concern to the cough, it is excessively sweet or salty in taste. And in concern to the touch, the pure breast milk is cold and non-slimy, and the cough vitiated breast milk is that is the slimy in nature and it is thickish in consistency. So in concern to the in concern to the water and milk relation, so whenever we pour the milk in water, so the pure uh, milk or purest breast milk is it creates the miscibility or dispersion, while the cup vitiated breast milk is there, it sink into the water, and the water the vat vitiated milk is there, it float on the water and create the foams, and while the pith vitiated milk is there, it creates the yellowish threads on milk. So it is about the organoleptic examination related to assess the pure or impure breast milk. Now, function of the Stanya. What is the basic function of Stanya? So, Stanya responsible for the development of breast and life of the infant by providing nourishment. It has been called the life of children. Now, quantitative pathology. So, whenever the quantity of this Stanya is increase or decrease, so what are the pathological consequences that take place in the human? So, whenever the quantity of the breast milk is increased, the breast become congested, frequent flow of milk and pain in the breast is take place. So whenever the quantity of the breast milk decrease, wasting of the breast, non-production or scanty production of the stanya is take place. Now composition of the breast milk. So basically after the birth up to the 0 to 5 days, the breast milk is termed as a colostrum, which is liquid gold. It is also called as a liquid gold, which is in a deep yellow thick sticky color, and which is high in proteins, fat soluble vitamins, minerals, antibodies, immune cells and growth factors. And the up to the 5 to 14 days after the birth, the breast milk is termed as a transitional milk, which is thinner and bluish whitish color and which is high in fat, lactose, water-soluble vitamins, and increased calorie. And after the 2 weeks and onwards, the whatever the breast milk is there, it is termed as a mature milk, and which is whitish, watery, and less concentrated in consistency. And it composes the optimal amount of the carbohydrate, fat, proteins, and 90% of water for hydration. Now, when should the child be breastfed after birth? So, usually within first hour and exclusively up to the 6 months. The WHO and UNICEF recommend continuing breastfeeding for 2 years or beyond. How often should a newborn be fed? So up to 1 month, every 2 to 3 hours, 8 to 12 times per day, and 2 months, every 3 to 4 days, 7 to 9 times a day, and at the 6 month, so every 4 to 5 hours. So benefits of breastfeeding for child. So breast milk is a power packed ideal nutrition needed for good health and normal development. So breast milk is contain antibodies, especially immunoglobulin A secreted in colostrum. IgA form a protective coating inside the nose, mouth, and digestive system, thereby preventing tissue damage. Antibodies help fight off infections, viral bacteria. Exclusively breastfed infants are at reduced risk of developing allergic disease, skin allergic, and asthma. So bowel disease, Crohn disease, ulcerative colitis, and so on, obesity or diabetes at a later age. So they are less susceptible to catch cold, ear infection, acute respiratory or gut infection. So promote brain development and improve cognition. So the child who has been breastfed is likely to have better IQ, intelligence quotient, and learning capabilities. So benefits of breastfeeding for mother. So help loss weight, breastfeeding burns calories and help to shed extra kilos gained during pregnancy, promote uterine contraction, thereby reducing the blood loss after birth and help to bring the uterus back to pre-pregnancy size. Increase emotional bonding with the child while nursing, reduce the risk of postpartum depression, for example, that develops in few mothers after the childbirth, reduce the risk of cancer, that is breast or ovarian, or protects the mother from developing high blood pressure, high cholesterol, heart disease, and diabetes. So what are the key points of this entire lecture is that milk production is demand driven. More frequent suckling causes the more milk production. Emotional stress, fatigue, and poor nutrition can affect milk quality and quantity. Breastfeeding builds strong mother-child bonding, supports immunity, and promotes optimal infant growth. Thank you. Om Sri Matre Namah.